I was dropping Mischa off at preschool, and it was actually only like nine months ago. And I gave her a hug goodbye, and I felt some bumps on her neck, from 3 of them. And I took her to the doctor to have them checked out, and they had us just kind of wait and see. And she ended up soon after getting a sinus infection type of symptom. And so we went home with an antibiotic, but the bumps didn't go away, they actually progressed. They said this isn't an infection, this isn't a virus, this appears to be a malignancy. And they had a chest x-ray done and blood work, and they confirmed that there was a mass in her chest. There's lymph in the chest, and then there's lymph in the adenoids. So we went from thinking she just had a really bad cold, maybe, to finding out she had a life-threatening condition. And that is a big adjustment, and I explained to her that we were going to the hospital to find out if her body was fighting a little battle or a big battle. So when we got her diagnosis, we talked about how it is a big battle that we're about to fight. And she's doing such a good job. So, but I had to kind of just deal with it very quickly and adjust best I could so that I could learn what needed to be done to take care of her, because you go from kind of a normal life to being involved in the medical world and having a child that needs vigilant medical care day and night. When she was diagnosed, they had her treatment plan set already for the next 2.5 years or so. We knew almost by the day what chemo she would get and at what dose. So it's really comforting to know that there's been enough research done and enough history to have these protocols available. I knew of the Leukemia Lymphoma Society, and it took me about a month to give them a call, and it was really nice to talk to somebody and get a perspective. I got a little pep talk, you know. They explained to me chemotherapy, the side effects, everything, it'll come in waves, and when you think you're adjusted, another wave will hit, and that's normal. You know, I felt very happy that I made that call. You know, we ended up hospitalized for a full month, and I met a lot of parents that were just starting their journey, and I remember how that felt. And I pointed them to the Leukemia Lymphoma Society so they could get connected and, you know, meet other families and understand the resources available to them, because it is so valuable. Mischa adjusted in 2 days what took me 2 months to adjust to. She was able to just get very acclimated to that very quickly, and that was wonderful to see her adjust so well. Mischa has a little brother and a little sister, and they're twins. They're 3 years old. So they play a lot together. One of Mischa's favorite things, even before all of this, was medical, playing, you know, with medical supplies, helping people with injuries, making sure you had Neosporin under your Band-Aid. And since being in the hospital environment, she's really learned a lot. And we try to make it a learning experience when we're there, understand the different jobs. Is there one you prefer, the doctor or the nurse job?
Nurse.
How come?
I like doing blood draws.
You like doing the blood draws. Do you like getting the blood draws? They're okay? Do you do ballet with sister in our house? Is it all a-okay? You know, she's been really a trooper. I mean, she really does just do what needs to be done and then goes and plays. And so she's been such an example to me on how to handle a medical struggle.
Help kids cure more cancers.